Hello students, today we will see stool examination. So what is stool? It is a excretory product of the digestive system, that is gastrointestinal system. So normally feces contain water, undigested, unabsorbed food residue, bacteria, intestinal secretions like bile, urobilinogen. Because of that it is brown in color. The consistency is soft and color is yellowish brown due to breakdown products of bile, that is hemoglobin, and usually it is 1 to 3 times per day. So indications of examination of stool, usually for the detection of parasites like hookworm, roundworm, Entaphima histolytica, which causes amoebic dysentery, or bacterial infection like bacillary dysentery or diarrhea in enteric fever, cholera, or for the malabsorption syndrome, or to see excessive hemolysis we can do stool urobilinogen test, or any bleeding in gastrointestinal tract you can see by doing occult blood test. Collection of stool for routine examination, usually stool sample collected from the whenever stool is passed in stool container, that is container contains lid and lid with the spoon, so in that spoon you can collect that sample. For quantitative examination 24 hours sample can be collected. In that, green vegetables to be avoided because occult blood can come positive in green vegetables. And for cultural examination it should be collected in sterile container, and if delay in processing then you can add stool preservatives like polyvinyl alcohol, formalin, and merthiolate sodium fixative. Hello students, today we will see physical examination of stool. So in that we should see color, consistency, mucus, blood, and volume. So color, normally it is brown, but if abnormal like red, then it can be because of the bleeding. Black color, that is called as melena, can be because of the bleeding in upper GI tract, and because of that it becomes black in color. Clay or color can be in obstructive jaundice. Fatty color or frothy stool can be seen in steatorrhea, that is malabsorption, or giardiasis. Consistency, normally it is solid. If it is loose or liquid, it can be seen in diarrhea, dysentery, cholera, lactose intolerance. In cholera it can be rice water, or hard can be seen in constipation. Mucus, normally it is absent, but if it is present it can be seen in bacillary dysentery. Blood, normally it is absent. If it is present it can be seen in bleeding conditions like piles, fissure, amoebic dysentery, ulcerative conditions in the GI tract. Volume, normally it is small volume, but if it is increased it can be seen in diarrhea or indigestion. Thank you. Hello students, now we will see chemical examination of stool. So first test is occult blood. So occult means the blood which is not seen by eyes, that is hidden blood, is called occult blood, and then that we can confirm by benzidine test. So in that you have to take benzidine reagent and then add glacial acetic acid, hydrogen peroxide, then add stool sample and see blue color. Immediately if it is there, then it is positive, and that is occult blood seen in bleeding ulcerative conditions. In this picture you can see this filter paper with blue color, so that is positive occult blood test. Second test is pH, so that is done by pH paper. Normally stool is acidic, and if alkaline then that means bacillary infection is there. Third test is reducing substance, that is done by Benedict's test as we do for urine, and it is seen for the lactose intolerance in a newborn babies. So same, you have to take Benedict's reagent, add stool sample, mix and boil and see for color changes, and if color changes from green, yellow, red, then it is positive test. It is positive in lactose intolerance in the babies. Thank you. Hello students, now we will see microscopic examination of stool samples. So that we do by saline method and iodine method. So in saline method you have to take 1 drop of saline, add some stool sample, mix and put cover slip and see under microscope, that is saline wet mount. In iodine you have to take 1 drop of Lugol's iodine, then add stool sample, mix and see under microscope. So in saline preparation we can see motility of the tropozoites, and in iodine preparation we can see all cyst form. So in this microscopic examination we can see cysts of or ova of roundworm, hookworm, tapeworm, whipworm, and other parasites also. So this is a microscopic examination of the parasites. Thank you. I hope this session you will find useful. Thank you.